Harrigan, who is a patient advocate. Over 450 new cases will be diagnosed in the Virgin Islands every year. About over 30% of U.S. Virgin Islanders are not insured for medical expenses, which clearly would add financial pressure on an already stressful cancer diagnosis. Cancer is one of the leading causes of death in the U.S. Virgin Islands, and the economic and emotional burdens of cancer are significant to the affected individual, their family members, and the community at large. So I want to welcome warriors to our conversation today. Let's start with Barb, if I may. Can you introduce yourself and tell us about your work?
Sure, Amelia. Thank you so much for having us and coordinating with Anique. My name is Barb, Michaud, and I am the Director of Cancer Support VI. This is an organization that was started back in 2005 by Charlene Kehoe and the Stevenson family, where they wanted to create some education and prevention in the community. After a year, it was realized that there was a bigger need, and that was for financial support. So thanks to the Stevenson family, we are celebrating our 20th year. The Stevenson family has donated over, I think it is close to $5.5 million in operating expenses to support 100% of every donation that we raise goes directly to support a cancer warrior. And so in 20 years, we've been able to give out, I think we are at over 4,800 grants exceeding $6 million. Powerful contribution to the community in need. So 100% of every dollar we raise goes directly to support someone on St. Thomas, St. John, and St. Croix. And that's sort of the premise for what we do. We are always we are the largest nonprofit in the Virgin Islands that raises awareness and funds. There's other incredible organizations that also raise awareness and funds. And as you can imagine, without our cancer center since the hurricanes, our private sector and our nonprofits are essential to supporting those impacted by cancer, because so many of our warriors have to leave the island. And as you stated, those numbers are probably underestimated. The number one cancers in the VI are breast, prostate, and colon. And as you can imagine, radiation would be a very effective tool. We don't offer that. We hope to when the Charlotte Kimmelman Cancer Center reopens. But in the meantime, I can't reiterate enough that Anna and Anique will speak more directly to how we best serve this population.
You've been in existence for 20 years, and sometimes what's right next door, we just don't know what's available to us, and that can be helpful. Anna, welcome. Tell us about your role as Director of Operations for this organization.
Sure. Again, we're super happy to be talking with you today. The more we can talk about Cancer Support VI and let people know about our services, the better everybody is. We want to make sure that people know that we're out there and that we're here to help. In my role, I'm in the back end, and I try to make sure that things run efficiently. Anique is busy working with the day-to-day of the grant applications and the applicants, and making sure they have what they need. And then when it's time to get processed, that's where I come in. Barb reviews them. I make sure that everything, is in order. We've got the financial information. We process grants on a weekly basis. So that's another thing that I'm really proud of this organization. You don't have to wait for your money. We know that there's, that cancer causes these financial hardships, and we don't want people to have to wait for them. We want it to be an expedited process. And of course, there's all the other, I consider them exciting, but to a lot of people, they're boring behind the scenes. But, we're in fundraising season now. And so we're communicating with businesses and schools and churches and developing partnerships for our big month of Pinktober. We want to make sure that we're reaching all all sectors of the community. We want to work with the housing development communities and churches and just getting that information out there.
Okay, so then let's clarify. We're talking about grants. What does that mean to a person who just recently discovered that they have a diagnosis of any type of cancer? You don't necessarily limit yourself. Oh, you have this type. We're not going to support you, right? I mean, there's no limit there.
That's correct.
Okay.
I'd be happy to answer the question, but I think, Anique, would you like to roll into that, our patient advocate?
Oh, sure. Good morning again. And just thank you for this opportunity to speak and share awareness. So what does that mean to get a grant if someone is just diagnosed? We have very limited resources in the territory. And what that means is you have an opportunity now to get resources to move forward with your cancer care. We have wonderful oncologists here on island. And like you mentioned before, a large percentage of the population is uninsured. So this financial grant would allow them to move forward to seek services, whether on island or off island. Currently, if a person is insured, they can get up to $2,500 a financial grant. If the person has Medicaid, they can get up to $4,000. And if an individual is uninsured, they can get a $5,000 grant. And what a lot of individuals do is they actually just use that funds to pay their doctor's bills, to pay for medication. Sometimes there's some non-medical expenses. They will use that grant for that. And then some individuals, if their treatment isn't available on island, we can work with them to, see that they get off island. We work with another organization, American Cancer Society, that helps them, with reimbursements for airfare travel, some hotel and stuff like that. So the grant is a lot. They can then see their way through to getting to the next step for cancer care. So it's very, very important.
So, Anique, you would have essentially, I'm assuming, a caseload, correct, of individuals who contact Cancer Support VI, and then you proceed from there? Is that how it goes?
Absolutely. So when we are on the radio like this, or we're out in social media, or folks give a call, we get that information. Folks will call me if they're seeking assistance. We also work with the oncology offices. We work with Department of Health. We work with the hospital, other case workers that will contact me. And we have a physical office, which is great. I am located in the Medical Foundation building behind the hospital, adjacent to the Paragon building on the second floor. We're here. So sometimes individuals are just walking by and they could just come into the office. So there's different ways to communicate with me. And once they come in, we get all the required documentation and they move forward. And I just wanted to mention, you asked, what does the grant mean? And if we are, specific to any type of cancer, the two criteria to qualify for Cancer Support VI financial grant is that you have to be a resident of the Virgin Islands and you have to have a positive diagnosis. We don't discriminate. We don't, just treat certain types of cancer or offer help for certain types of cancer. We don't do that. We see you as a Virgin Islander here in the territory. All of the monies raised in the territory stays here. So it's definitely a great program and a help for those impacted by cancer.
Well, kudos to the Stevenson family who got this going, for sure. Now, Anique, your location, physical location, is in St. Thomas. If somebody was in St. Croix or St. John, what's the best way to reach you?
The best way to reach me is by my number or my email address, and that number is 340-514-8647.
Okay.
And my email address is Anique, ANIQUE .Harrigan, HARRIGAN @cancersupportvi.com. And all of that information is on the website.
Okay, great. And the website is at cancersupportvi.org, correct?
That's correct.
You got it right.
Okay, great. How did you get started? You mentioned the family, okay? And you're now, I understand, officially a nonprofit organization, which is different than not. What did it take to get that going?
Well, this is Barbara. We started as a fund within the Community Foundation of the Virgin Islands. And so they managed our funds. They basically supported our funds, our donations. It became a hub for our donations, and that they would issue the patient grants for us on a weekly basis. We pretty much have been standalone for all the other parts of running the organization. And we're the largest for the Community Foundation of the Virgin Islands, and decided that we were in a place as we grew and want to continue to grow as an organization that it would benefit us to just do the legwork and the paperwork of becoming our own 501c3.
Right. And it's not an easy task. I can speak to that personally. I know.
Well,
Tell us about what's coming up in October, or what's now in October. What do you call it? Pinktober?
Pinktober.
What is that?
Pinktober was coined. I don't want to say I coined it, but it was coined back, I think it's 11 years now. I was diagnosed with breast cancer in 2013. I worked in marketing at the golf course, Mahogany Run.
Mm-hmm.
And I always use I think it's Maya Angelou. It's not what you did. It's not what you said. It's how you make someone feel. I was
Yes.
an uninsured cancer patient living in the Virgin Islands
Wow. Okay.
and did not want to ask for help. I was too embarrassed, too ashamed. All the things that Anique experiences with people when it comes to asking for help. It's a very prideful thing.
Right.
And so when I met Charlene Kehoe, the previous director of Cancer Support VI, I walked into her office with my head down and she looked at it. She said, "Give me your name, your address, and where to send the check to." And I owed thousands and thousands of dollars. And that, at the time, it was a $1,500 grant. It might as well have been the full amount of what I owed.
Mm-hmm.
She just made me feel
Right.
unashamed and welcomed, and it was okay to receive.
Right.
And she followed me along on my journey. And that was very meaningful for me. So fast forward a year later, I just wanted to pay it forward.
Mm-hmm.
And so to pay it forward, I went to the team and said, Mahogany Run, and said, let's pay it forward. And we started doing a golf tournament, and we did a wine tasting, and we worked with Fellows International, who supported helping us raise. I think our goal was to raise $5,000. And the first year we raised $17,000. And within the first 3 years before it blew away in the hurricanes, we raised about $94,000. And so there was just the opportunity then, therefore, to keep building upon that by going to local businesses and celebrating, as Anna and Anique can speak to, Breast Cancer Awareness Month. It's it's one of the largest worldwide months for fundraising. We raise for all cancers during the month of Pinktober.
Mm-hmm.
Every year we do give cancer the boot. Probably no one here is old enough to know back in the day, Jerry Lewis used to take his boots out for his telethon. So we have pink boots out everywhere, and it involves schools and churches and people and businesses that get excited about going and standing at Cost You Less or the market or the middle of the highway and saying, every dollar matters. And it allows us to see, we don't just rely on when I say sponsor, on a large company's donations. Those are incredible, but we go into the belly of a business and we talk about who we are. And it's not the staff that we're necessarily asking for their donations as much as we're asking them to go into their churches and other community involvement that they have and share our information, because we're certain that there's people within those realms that are in need of support. It's as important to us to raise the awareness
Mm-hmm.
as it is to raise the funds. So we have a lot going on in Pinktober. We'll have a calendar of events where we're wrapping those up now for sure. Anna or Anique Anna, if you'd like to speak a little bit more in depth to Pinktober.
Sure.
Yeah, good.
Yeah, I was going to say this year, I think so far we have over 20 partner events territory-wide, and those are from, we have a big kickoff party the 3rd is a Friday, first Friday at Tapas. We have all sorts of events going on throughout the month of October that, like Barb said, increasing the awareness and also raising funds. So every time you're at Tap and Still and you buy a burger and you see a sticker on there with our logo on it.
Mhm.
There's somebody at Tap and Still who doesn't know about us, who needs our services, or knows somebody who needs our services.
No, excuse me, I'm ignorant. Tap and Still, what is that?
Tap and Still is a restaurant in St. Thomas
Okay.
in Red Hook.
Okay.
And we've got yoga classes going on in St. Croix that are benefiting Cancer Support VI, pumpkin carvings, and I mean, the list, I'm just trying, there's a whole pink drink like contest that goes on throughout the territory from one of the liquor distributors, and they partner with different liquor brands. Bars and restaurants will come up with a fun pink drink and sell it throughout the month, and whoever sells the most pink drinks, but it creates awareness for us, and that's our biggest message is letting people know that we exist and that there's help out there. We're trying to educate people as well that early detection saves lives, and providing those educational resources. We're really proud of a men's health hub that we launched on our website for Men's Health Month during June. And then we'll be doing the same for Pinktober. For October, we'll be launching a women's health hub. And it's resources right here in the territory. Where can they get screened? Where can they go for the assistance? Where does one get started with this?
Right.
If they're hearing this podcast and, I need to go get a mammogram, I need to go get checked, where do I get started? Go to our website, go to the Women's Health Hub, and that's, that can help you get started. Talk with your general practitioner. Talk with somebody if you're seeing somebody at a clinic. We've got incredible clinics territory-wide, from the Frederickstead Healthcare Clinic to the St. Thomas Easton, medical clinic that we work with as well. There's people around to help. That's what they're out there for.
Okay. So let's say, somebody needs to go to the men's hub. Is there a number they should call? Let's say somebody doesn't have access to a computer. How do they go about doing that?
This is Barbara. I would invite them to call Anique Harrigan, our patient advocate, who has the plethora of local resources that would be available.
That's good to know. That's good to know.
Yeah, for sure. And this year, I just piggyback off of what Anna was saying. We're partnering with the Virgin Islands Police Department, where you'll see a lot of pink wrapped cars. And
fun. So fun.
Sorry?
Pink wrapped cars. I'm trying to visualize this.
You haven't seen them? I've seen them on St. Croix already.
They're going to have pink wrapped, means that you'll see, they're covered in pink ribbons and
signage.
With catchy lines. Hopefully, we're trying to finalize it now. Have a design that we sent to them for the back windows will have Cancer Support VI and information on how to get help. So we're super excited. They decided to do a pink patch initiative, which is a worldwide initiative. But what I love about this nonprofit that is universal is it allows the VIPD to give the donations that they collect from the sale of these pink patches to Cancer Support VI.
Okay. A patch, that's something that you wear.
Put on their uniform.
It's a pink patch that I think it looks like I haven't seen it. Anique, I think you saw it.
Yeah, like their police patch that they have, their VIPD patch is right on their uniform. It's just, the print is pink, and it's real beautiful. Anna, I just texted you a picture of the vehicle so you can share with Amelia once you.
I know, because I'm just not seeing this. That's it shows some real community spirit and involvement. Sounds like a beautiful endeavor. Oh my goodness. Yes, I see the picture. Oh wow. Okay. So Anique, you are certainly in the seat of in the seat of the community, where the community is. I'm curious, your work, involving schools, housing communities.
Yes.
Tell us more about that.
So we just definitely wanted to dig into the community. I sit here and I get phone calls, I see applications, and, of course, everything is confidential, but you see the folks that are impacted and where they're working.
Right.
And sometimes what I'm learning too is that a lot of people want to give. They want to give back, but they don't know how. So I was like, you know what? Let's just go into the community. So we had a conversation with the Department of Tourism. We're working on some things there. East St. Thomas, East End Medical, they are fantastic. A lot of patients come into them. A lot of times we have individuals who speak Spanish or of the Creole language, Haitian background, and they just need help. So we're partnering with these individuals so that they can be aware of the services that we have. And at the same token, the individuals that are working in these facilities, they want to give back too. Working with the Virgin Islands Housing Authority, we would love to do something there where maybe every resident can give $5, give back, because again, it's our community. It's 18 housing facilities territory-wide. That's an area that can definitely be impactful as far as giving awareness, letting them know we're here. But at the same token, for the month of Pinktober, or throughout the end of the year, they can give back, whether they they have a food sale or a pink day or drive or whatever, and those resources come back to us. So again, like Barb said, in the past we may have had big payments from organizations. It's everybody. It's the big business, the small businesses, and the community members, because we're helping each other. We're supporting one another. So just trying to be creative. A lot of times we have patients, and when you look at the application, they have children. So just getting into the schools, educating them. Last year, we received a handful of letters from elementary school students that wrote letters to cancer patients. And I think that's good. Maybe we can do that again in multiple schools. But again, it's all about educating the individuals about, the organization that we have here, what cancer is like. And then also teaching them from a young age the importance of giving back, paying it forward.
Right.
So I'm excited just to get into these different areas so folks can know, this is a worthwhile organization that is doing things in the community. You have the data. I actually pulled some numbers here for our call. So to date, we have served 211 patients territory-wide, 114 from St. Thomas, 89 from St. Croix, and 8 from St. John, totaling, Amelia, $579,000 thus far.
Wow.
Okay.
Wow.
And, we want folks to know we're here, but at the same token, if we continue to give funds and then funds aren't replaced into the account, then we won't be able to continue this work. So that's definitely, what we're here to do. And I'm excited. I feel like it's a pleasure and an honor to be the person on the other side of the line that is, that could help or could guide or could navigate a patient. Hey, here's an oncologist. You know what? We also were able to speak with the Medicaid office, just trying to educate ourselves. So when a patient comes to us, we know the best way, to assist them. So it's really purposeful work, and I enjoy doing it every day, I have to say.
Well, it shows. It certainly shows. You're to be commended for your spirit, because it's really sorely needed here. What do you see? What are the future plans for the organization long term? I mean, we talked about Pinktober. What do you see? I mean, I'm clearly we are under some serious fiscal constraints, and it's very clear to anyone who is in any part of this country that we are going to have to look into ourselves to build ourselves up.
Absolutely.
So, long term, what do you see as your future for the organization?
Barb, you mind if I take a shot at that one? Or you? I don't know. Is Barb still on the call or no?
Yeah, I'm sorry. The guys are drilling upstairs.
No problem. So, Anna, go ahead.
Anna.
Yeah.
We definitely want to continue to provide financial support, but our goal is to provide more than that. We want to broaden the education piece, and we want to make sure that 100% of diagnosed cancer warriors in the VI are assisted. What does that look like? We have a lot of ideas. It's just me, Barb, and Anique. And you just said, we have to look within ourselves. We rely so heavily on volunteers because it is just the three of us. And we do have great ideas, and people want to support us and help us so much that it's the volunteers that allow us to just put on a 4-day tennis tournament that we just completed here in St. Croix. We'd be lost without those day-to-day volunteers. And being in from now through the end of the year is heavy fundraising season for us. And we want to support our partners who are supporting us. So if we can send a volunteer to be in an event to help with something in any way, even if it's just to have a table there with our information on it, we want to make sure that we can do that as well. So, we're strategizing. We've been strategizing for 2026 and what we can do, because we always want to improve. We need to stay up with the times. What can we do to serve the patient better? What can we do to make this easier? What can we do so that they have better access? And even like you said, I was reading over your website this morning, and well, first of all, one of the things I'm proud of this past year is providing information in Spanish. Reading a population, getting out to a population that we have not been able to reach directly in that manner before. But reading your website last night and this morning was reading the blind population. It may not be a huge population, but it's still somebody that needs our information. How can we work together to get our information into what they need to serve?
Quick question. How do you have any contacts with communities that are dealing with or families who are dealing with the stress, with the psychiatric aspects of a cancer diagnosis? Have you partnered with any entity or individuals?
So you mean like a therapist office?
Right.
Or there are support groups out there that we work with, and that's part of the resources that we're building as well. For caregivers, for diagnosed cancer patients, providing that mental health piece to make sure that they're taken care of. Absolutely. So important.
Right. Well, and I just want to add to that with Anna, we do have those groups here. I don't think we have an active group of any type in St. Croix. So if folks are listening, and I know we have cancer patients, cancer survivors, and caregivers in St. Croix, they can definitely reach out to us, just to, get that out there. Because I have had individuals contact me seeking support groups in St. Croix, and I don't know if any were building that. So that's a very good point.
Okay. Well, again, I'd like to thank our guests today, Anique Harrigan, patient advocate, Anna Holley, director of operations, and Barb Michaud, president and CEO of Cancer Support Virgin Islands. Thank you so much for listening. And I'm going to put out Anique's phone number again, 340-514-8647. Any questions, direct that to the superb patient advocate, Anique Harrigan. Folks, thank you so much for listening to us today. Have a great day.
The views expressed on this program are not necessarily those of WTJX, its board, staff, or underwriters.